Ooh, okay. That's fine. That'll work. $1 Million Baby. The name of the article written about my brother's birth. And why was there an article written about my brother's birth? Because he was born with hypoplastic left heart syndrome, and at the time of his birth, the treatment for that was extremely experimental and therefore extremely expensive. I'm credible to tell you about this because my brother has it, and that means that I spent my whole life hearing about it, from my parents, my brother, and even conferences we've attended about it. In addition, I have done plenty of research on hypoplastic left heart syndrome because I'm nosy and I needed to know everything going on in my brother's life. You should listen to my speech because it will make you smarter because you're learning about a medical disorder as well as treatments for it that you likely have never heard of before. Today we will first go over the signs and symptoms of hypoplastic left heart syndrome. Next, we will cover the treatment, and finally, we will discuss what it's like to live with it. Now that we've established that I am going to inform you about hypoplastic left heart syndrome, let's discuss the signs and symptoms. In order to talk about the signs and symptoms of hypoplastic left heart syndrome, we must first make sure that you actually know what it is. It's a congenital heart defect in which the left side of the heart is severely underdeveloped or simply non-existent. As you can see in the pictures on the slide, they look very different visually. According to the Children's Hospital of Philadelphia, on the 2nd of April 2014, in a normal heart, the heart's left side has the job of pumping oxygenated blood into the aorta, the large artery that carries blood throughout the body. Obviously, with an underdeveloped left side, that is not the way that a heart is going to be able to work. Now, depending on when they discover the disorder will depend on the symptoms found. If it's found in utero, also known as when the mother is still pregnant with the baby, they're likely to pick up tachycardia in an ultrasound, which is an abnormal and rapid beating of the heart. From there, it's likely that they will order an EKG or an echocardiogram in order to see the physical appearance of the heart. After a baby is born, the Mayo Clinic staff from Mayo Clinic on December of 2020 says babies born with hypoplastic left heart syndrome usually are seriously ill soon after birth. They develop symptoms such as cyanosis, which is a bluish or ashen tint to the skin, breathing difficulties, feeding difficulties, and circulation problems, which cause the hands and feet of the baby to be very, very cold. Additionally, they will have rapid pulse and extreme drowsiness. With the signs and symptoms of hypoplastic left heart syndrome discussed, let's move on to the treatment plan. The treatment for hypoplastic left heart syndrome is what's known as a staged reconstruction surgery. Essentially, this means that the surgery is done in several parts at different ages. This specific treatment plan calls for 3 surgeries. According to Mary DeVroe and Alexander A. Kahn for the American Journal of Bioethics in July of 2017, before there were surgical options for babies with hypoplastic left heart syndrome, 95% of affected newborns died within the first months of life. So while this treatment was extremely revolutionary, it greatly increased the chance of survival. The first procedure is known as the Norwood procedure, and it occurs within days of the baby being born. This is all about blood flow control and making sure that the blood is able to get oxygenated and move through the body despite the severely underdeveloped left side. The next procedure is known as the Glenn procedure or the Hemi-Fontan procedure, and it occurs at approximately 6 months of age. After the completion of this surgery, all of the blood in the upper body will now bypass the heart and go directly into the lungs. The final procedure is known as the Fontan procedure, and it occurs between 1.5 and 3 years of age. By the completion of this surgery, all of the blood in the body will now bypass the heart, go directly into the lungs to get oxygenated, and then go into and back out of the right side to move through the body, which is what is depicted on the screen there. The treatment of hypoplastic left heart syndrome doesn't cure it, so let's talk about what it's like to live with it. One of the biggest parts of living with this disorder is the medicine. Every day, they need to take blood thinners in order to account for the blood going into and out of the same chamber rather than moving only in one direction. Additionally, they need to take antibiotics before any kind of procedure, including going to the dentist, due to a heightened risk of infection. In an interview with me, Sean Farkas, who has hypoplastic left heart syndrome, said in May of 2022, "Thankfully, the only medication I need to take is over-the-counter aspirin, so I don't need to deal with the ridiculous prices that other Americans who need more specialized medicine have to." So if there's any kind of silver lining here, it's that their maintenance meds are over-the-counter, so they're not as expensive as they could potentially be. They also have restrictions on things like the amount of weight they can carry, as well as going on rides, especially ones that go upside down, as that puts a lot of stress on the heart. When it comes to sports, it's not necessarily to say that they can't compete in them, they simply need to think about the level of competition and how much stress that's going to put on them. And when it comes to temperature, it's really important that they stay in cooler climates most of the time, rather than in higher climates, as again, that can cause a lot of stress on the heart. Complications can arise, such as arrhythmias, which is an abnormal beating of the heart, edema, which is the retention of fluid, growth issues, clots forming, which can lead to stroke, as well as liver problems, which typically comes with the prolonged use of medication. We've now talked about living with the disorder, so as I bring the speech to a close, I will review the contents of this speech. First, we discussed the signs and symptoms of hypoplastic left heart syndrome. Next, we discussed the treatment, and finally, we talked about living with it. My family was extremely lucky in that my brother didn't have any severe complications, which is not usually the case with individuals with congenital heart defects. And yes, my brother turns a little blue if he's a little too cold or laughs or cries too much. And yes, he was definitely $1 million baby, but these are trade-offs that I think we're willing to live with.